Hey guys, this is Thomas Wells, founder and CEO of The Body Mechanic, and I'm going to demonstrate for you today a stretch called Sacro-Iliac gapping. So the Sacro-Iliac joint is the joint right about here where your spine and your pelvis meet. You have one on the left and the right, and it's a chronic area of pain and dysfunction. The ligaments there can get really restricted and create quite a bit of pain. What most people describe as low back pain, they're often talking about those sacroiliac joints. And you'll often see people pointing with the back of their hand when they describe their pain, which is usually a dead giveaway. We're dealing with the SI joint. So the stretch for this is called sacroiliac gapping, and I'm going to demonstrate it for you here in just a second. And it's kind of a three-part stretch, so there are three components to it, and when you combine all three motions together, it creates a really nice opening up of the sacroiliac joint and can really offer quite a bit of relief. All right, so there are three components to this maneuver here. The first part, say we're going to be doing this for the right side. The first part is to internally rotate this right hip. So we're turning it inward like this. You're not going to do this forcefully, just enough that you feel a nice stretch. So it's not going to be intense. So you're going to hold that. With this opposite leg, you're going to reach your leg down longer, lengthening through that leg. And then with this right hand, you're going to find the point of your hip and you're going to press across body with it. So you're going to press over to the left. So none of those three things are going to be done forcefully, but each one done lightly in combination will amount to a very good stretch. Okay, so you're going to do all three motions. And once you have all three motions engaged, you're going to hold that. You're going to hold that for 3 breath cycles. So 3 ins and outs. Once you're done with 3 in and out breath cycles, you're going to relax all 3 motions, and then you're going to re-engage. So turning inward, reaching outward, and pulling across with your hand. Again, for another 3 breath cycles. So you're going to do every 3 breath cycle, we're going to count as 1 repetition, and you're going to want to do about 20 repetitions per side that you're trying to stretch. So given kind of a standard respiratory rate, in that kind of 12 to 20 breath a minute range, this should take you about 5 minutes to do per side, but it does offer quite a bit of relief. So this stretch is going to work best for you if you have a compressed sacroiliac joint, where the joint is too tight. This is as opposed to kind of an unstable or loose sacroiliac joint. So if you have a loose or unstable sacroiliac joint, this is not going to be the right stretch for you, and this probably won't feel very good. So if you do this and it makes you feel bad in any way, then this is probably not the stretch for you, because this should actually feel quite good. This is a really handy thing to do just kind of on the spot when something's bothering you, to offer you some sort of instantaneous relief, and it's really effective for that. So there's no limit to how many times a day you can do this. Again, 23 breath cycles per side should take you about 5 minutes per side if you're doing it right and you're not rushing it. So try this out, and I hope this helps you with any SI pain you might be having.